Hi everyone. In this video, we will be studying about teratogenicity, that is, adverse effects of mother taking any drug and the effect of it on the growing fetus inside the mother. So, first is amphetamines. Amphetamines is causing hepatic calcification. How we will remember amphetamines is drug that is abused, and abused drugs like alcohol abuse that causes hepatic effects. So amphetamines will also cause hepatic calcification. Then we have androgens. Androgens, we know that it will cause masculinization in the female fetus, and what along with that it can cause cleft palate, cleft lip, and tracheoesophageal fistula. Okay, fistulas can occur and cleft palate, cleft lip. Then barbiturates. Barbiturates can cause abruption placenta and microcephaly. Barbiturates, CNS depression they can cause, and so microcephaly and also abruption placentae. Then we have busulfan. Busulfan can cause corneal opacities, cleft palate, hypoplasia of the ovaries, thyroid, and parathyroid. So busulfan will be affecting the hormones, thyroid and parathyroid, and also the ovaries, gonads. It will affect then the corneal opacities and cleft palate. B is followed by C. So corneal opacities and cleft palate, and also ovaries, thyroid, and parathyroid glands is affected. Then carbimazole. Carbimazole is anti-thyroid drug, so it can cause scalp defects. Scalp defects, cutis aplasia, and also corneal atresia. Corneal atresia is a facial atresia. Okay. Then antithyroid, so the deglutition will not occur. Then chloroquine can cause deafness. Along with chloroquine, remember quinine. Quinine is also a group of drugs related to antimalarials. It can cause deafness, and along with that, thrombocytopenia. Danazole. Danazole causes virilization. Diazepam. Diazepam, benzodiazepines, causes cleft palate, cleft lip. Barbiturates. Barbiturates are also type of sedative hypnotic drugs. These are causing microcephaly. Here, the hypothermia is occurring. In the benzodiazepines, hypothermia and apnea, respiratory depression, palate and cleft lip. Cleft lip and palate was also there in the androgens and in the busulfan. Then diphenylhydantoin. Diphenylhydantoin can cause facial, cardiac, and limb anomalies. Facial, cardiac, and limb anomalies. Gentamicin, that is aminoglycosides, 8th cranial nerve damage. Misoprostol and mifepristone. These are used in the abortion cases. Misoprostol can cause M for misoprostol, M for Mobius syndrome. Mobius syndrome means convergent type of vision. Then is phenytoin. Phenytoin can cause antiepileptic congenital anomalies, intrauterine growth retardation, neuroblastoma, and bleeding. Phenytoin, but it can cause bleeding. Then is neural tube defects, neuroblastoma, neural tube defects, and a neural tumor, and intrauterine growth retardation. Quinine we have already done. Tolbutamide, thrombocytopenia, valproate, CNS, neural tube defects, then cardiac, limb defects, and facial. Cardiac, facial, and limb defects. These were occurring in the diphenylhydantoin also, and in the valproate also. Cardiac, facial, and limb defects are occurring. Then vitamin D, supravalvular aortic stenosis, and ventricular opacities, and alpine phases. Supravalvular aortic stenosis, opacities, and alpine phases. Mainly important is aortic stenosis. So let's revise again. Amphetamine, hepatic calcification, androgen, masculinization, cleft lip palate, tracheoesophageal fistula, then barbiturates causing microcephaly, CNS depression, and also placenta. Okay, barbiturates are abrupting the placenta. Then busulfan, corneal opacities, cleft palate, and the glands are affected. Busulfan, glands. Okay. Then carbimazole, scalp defects, cutis aplasia, corneal atresia, esophageal atresia, chloroquine deafness, quinine deafness, and thrombocytopenia, danazole virilization, diazepam, cleft lip palate, apnea, and hypothermia. Diazepam and androgens, DADA. Okay, both are same. Dicumarol depressed nasal bridge, stippling of phalanges, and corneal atresia. Dicumarole is warfarin type drug. Okay, diphenylhydramine facial cardiac and limb anomalies. Facial cardiac and limb anomalies also occurring in valproate. Gentamicin 8th cranial nerve, misoprostol Mobius syndrome, phenytoin, neural tube defect, neuroblastoma, bleeding and IUGR. Tolbutamide thrombocytopenia. Vitamin D, supravalvular, aortic stenosis, ventriculopasties and alpine phases. Then here is another group of drugs which were missing in that. Here we will be studying ACE inhibitors, renal failure, oligohydramnios, hypocalvaria. Renal failure, oligohydramnios, okay, because the urine is not produced. So, and another one is hypocalvaria. Then alkylating agents, multiple anomalies, ear, facial, and absence of digits. Aminoglycoside, ototoxicity, 8th cranial nerve, we have already done. Anti-epileptic, neural tube defects, cardiac defects, cleft palate, skeletal abnormalities. That is facial, cardiac, limb anomalies we have done. And due to valproate, carbamazepine, phenytoin, phenobarbital, high dose folate supplementation required. Diethylstilbestrol, vaginal clear cell carcinoma, and it causes Mullerian anomalies. Which type of Mullerian anomalies we have done in the obsgyne? Type 7. Then is fluoroquinolones, cartilage damage, folate antagonist, neural tube defects due to trimethoprim, methotrexate. Then isotretinoin, craniofacial, microtia dysmorphism. Cleft palate also is caused by this. CNS, cardiac and thymic defects. So basically cardiac defect, then we have facial defects, and also we will have limb anomalies, cardiac and thymic defects. Then lithium Epstein anomaly and macrosomia. Lithium is box shaped heart. Imagine a box full of lithium tablets. And macrosomia. Macrosomic baby is seen in diabetes and in lithium. Person taking lithium or antidepressant drugs will get fat. Okay, that we need to remember. Methimazole, aplasia cutis congenita. Methimazole antithyroid drug. Tetracycline discolored teeth. Inhibited bone growth. How will remember? Tetracyclines and also congenital cataract. Thalidomide limb defects, phocomelia flipper-like limbs. Warfarin bone and cartilage. Bone and cartilage. So bones are affected in tetracyclines and cartilage affected in warfarin and fluoroquinolones. Stipple devices, nasal and limb hypoplasia, optic nerve atrophy, cerebral hemorrhage. Use heparin during pregnancy. Alcohol causes fetal alcohol syndrome. Cocaine causes preterm birth, low birth weight, fetal growth restriction because it causes vasoconstriction. Tobacco smoking also causes sudden infant death syndrome and ADHD because nicotine also causes vasoconstriction. ADHD is due to impaired oxygen delivery. Brain is not getting oxygen, so attention deficit. Iodine lack or excess, congenital hypothyroidism, maternal diabetes. In the diabetes, we need to remember first is most common congenital anomaly is cardiac congenital heart disease. And among the congenital heart disease, most common is VSD. Most specific congenital is transposition of great arteries. And if we remember in general, most specific sacral agenesis. Maternal phenylketonuria, fetal growth restriction, microcephaly, intellectual disability, and congenital heart disease. Then methyl mercury neurotoxicity, X-rays, microcephaly, intellectual disability. So that are the important things we need to remember about teratogens. Now let's see a little more the types of errors which can occur. Agenesis, absent primordial tissue. Aplasia, absent organ despite presence of primordial tissue. Agenesis means primordial tissue ही नहीं था. एप्लेजिया क्या प्राइमोडियल टिश्यू तो था बट फिर भी डेवलप नहीं हुआ. हाइपोप्लेजिया क्या प्राइमोडियल टिश्यू इज प्रेजेंट बट इनकम्प्लीट ऑर्गन डेवलपमेंट हुई तो है बट इनकम्प्लीट. डिसरप्शन इज सेकेंडरी ब्रेकडाउन. Secondary breakdown like amniotic band syndrome. Deformation is due to extrinsic mechanical distortion. Example congenital torticollis. Deformation extrinsic की वजह से होगा. Malformation is intrinsic. Then sequence like oligohydramnios produces Potter sequence. Means single embryological event की वजह से काफ़ी सारी anomalies हो रही हैं. Field defect is tissues that develop in a contiguous physical space. Means the normal physical orientation is not there. Example, holoprosencephaly. In holoprosencephaly, the two lobes of the cerebrum or the brain are not separated, they are joined. And it is seen in Patau syndrome, chromosome 13. Then is fetal alcohol syndrome, intellectual disability, microcephaly, facial abnormalities. What are the facial abnormalities? We see small palpebral fissure. Okay, eyes will be small, philtrum will be smooth, and vermilion border will be thin, and nasal bridge will be flat. So, eyes, nose, lips are affected in the fetal alcohol syndrome. And also, VSD or ASD can occur, heart defects, holoprosencephaly. Holoprosencephaly, which was occurring in Patau syndrome trisomy 13, also can occur in fetal alcohol syndrome. And also agenesis of the corpus callosum in the cerebellar vermis can occur. That is called Shapiro syndrome. And what is neonatal abstinence syndrome? That is means the person or the female was taking pregnant female was taking any substance like opioids, and the newborns will present with the uncoordinated suckling reflexes, irritability, high pitched crying, tremors, tachypnea, sneezing, diarrhea, and also the seizures. Person taking the addictive drugs, pregnant woman taking the addictive drugs, the neonatal abstinence syndrome, the typical CNS symptoms will be seen in the baby. That is it. So that is all the important points about the teratogenicity which we need to remember for exams. I hope you will find it useful. If you like my content, please do share and subscribe my channel. Thank you.